Welcome to USMLE SART. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Good morning, good afternoon. Welcome, everyone, depending on your time zone. This is the USMLE SARTHI team, and this is a special webinar. We are going to talk about electives, rotations, externships for all of you who are probably going into the match next year. So probably applying in September 2025 or later. So this is focused on all of you who are in your USMLE journey, considering your USMLE journey and the importance of rotations and research. As we all know, USCE is very critical part of the USMLE journey. And without USCE, whether it's tele or on-site, match is going to be very, very hard. It's literally impossible to match without USCE. So with that in mind, we thought we'll have our physicians panelists who actually guide students in their rotations, who offer rotations. So getting their perspective on what is important, what students should be prepared for, and how they should be navigating, planning their USCE. And along with that, we have several students that you will hear from today and tomorrow. So it's a two-day conference where students will share their experiences in terms of importance of USCE, why should you start early, what skills and experiences you should be looking to gain out of USCE, how you should be prepared before you start your USCE, and overall then, how do you leverage this in your USMLE application, the IRAD application during the interviews and all of that. So in terms of housekeeping, as we get started, you will get to ask questions in the chat. My team is here and the panelists are also here. And it's a very, very quick and, to the point webinar. So ask questions in the chat. We will answer them. But of course, we want to give the panelists enough time to speak. So you'll get that experience also. So for today, we do have our first panelist, which is Dr. Amit Korea, and I want to see if he has joined. Amit, are you joined? Amit, are you there? Okay, I see him there, but maybe we need a couple of minutes to get him started. So I'll request one of my teams to text him. But meanwhile, as he is getting settled, I think our first speaker, Razia Sheikh, is already there. So Razia is a student, and let me give you, you should be able to share your, video stream, Razia.
Sure.
Let me know if there's a problem. Okay, good. So welcome, Razia, and why don't you introduce yourself and where you rotated, and then what we want to, talk to you about is when are you going in match, or if you've already applied, B, why should students start early, what skills and experiences they should look to gain from the US clinical experience first.
Thank you so much for hosting this webinar, and this is my first experience as a speaker. Some of my background history before I get started. I've graduated from NRA Medical College, Guntur, and let's cut straight into my rotation experiences. I'm applying this season, and so rotation was very crucial for me. I took one of the rotations from SARTHI, and this happened to be hematology oncology subspecialty clinic, where I rotated in two different hospitals. One was inpatient and the other was clinic settings. And so this was a great plus for me, as I had a diverse experience on interacting with the patients as well as the fellow residents. I was under the mentorship of Dr. Korea, and so this was one of my greatest experience, as he allowed me to look after the patients, and we got a sense of autonomy, what it is like to deal with the patients, both empathetically as well as having to get on the EMRs and navigating through the options. So this was completely a new experience for me because it was one of my first rotations. And so I found it very productive in terms of seeing how the US clinical experience is like. And so this has prepared me for the upcoming rotations that I had following this rotation. We were a team of 3 colleagues, and then we also looked at how the team building skills are coming into play and how we have to actually go through the management plan and come up on the EMR system. So this was very productive in terms of acquiring the skills as well as knowledge. In the first 2 weeks, we went through virtual sessions, and here we had a clear-cut idea about how it is to look after leukemia patients, sickle cell patients. We also looked at the standard protocols on how the management is based here, and then especially in terms of blood transfusions and platelet transfusions, there were particular protocols that were followed that was very different to what I learned in my home country. So this was very enriching for me to start with. And I would like to thank Dr. Korea for this wonderful
I'll
experience.
take a minute, Razia, just because I have questions for you, but I think Dr. Korea has also joined and he looks like he's driving. So I want to just switch to him first and then maybe come back to you. So welcome, Dr. Korea. Looks like you are driving.
Yeah, I'm on my way to work actually. I'm on call today, so I'm driving to one of the hospitals that Razia rotated at. It's called the Linden.
So very, very quickly, we don't want to take too much of your time. Why don't you introduce yourself and I'll ask you certain questions that we got from our students and then we'll let you go.
Yeah, so I'm Amit Korea. I did my residency at Mount Sinai in New York City, and then did a chief resident here thereafter, and then did my hematology oncology fellowship in UT in Houston, and then did a transplant and hematology fellowship thereafter. So right now I'm the director of hematology at Lyndon B. Johnson, and I'm also supervise the MD Anderson fellowship hematology rotations. So that's a little bit about me. I'm an IMG like all of you all, and I've been through the journey from Bangalore, India. And I really look forward to contributing in whichever way possible to, help your journey and help you attain the best out of this process. So that's a little bit about me.
So, Dr. Korea, the basic, I guess a lot of us, the students are getting started. So, if you can shed a bit of a light on why they should start early rather than scramble in maybe September or August to get these rotations. So, those of them who have like a year or so to plan, why starting early is important.
So to start off with, I think there are some students that are sometimes undecided if they want to go ahead with the USMLE journey or not, right? So it's very important for those students to come and rotate to see how the system is and to see, do they see themselves spending the rest of their lives in the US? Do they like the work culture over here? Do they like the way medicine is practiced over here? And is that something they see as a career path? So that's important for students who haven't decided, right? The other thing is, I think it significantly helps you with your STEP exam, especially your STEP 2 exam. Because if you have rotated over here, you understand the system over here, you understand how medicine is practiced, you see the common cases and things like that. And that significantly helps you with your exam process as well. The other thing is, if you get started early with your rotations, you should probably try and do at least 4 rotations. Try and have a diverse rotation portfolio. If you're doing internal medicine, try and do a rotation in internal medicine itself. Try and do an outpatient as well as an inpatient rotation. try and do subspecialties that are critical to internal medicine, be it hematology, oncology, cardiology, or even palm crit. So I would suggest doing about 4 to 5 rotations, trying to make sure you do inpatient and outpatient. Try and do it in different cities if possible, because you get a chance to get exposure to different cities and the culture in different cities. And that way, I think Sarthi is really good because they have the opportunity for you to do rotations in different cities. And I've had students rotate in different parts of the US. And when I talk to them and interact with them, I feel like they have so much of experience and they've learned so much in that time because they've got a chance to really interact with and explore the US as a whole. So those are the things I think are important. And if you start early, you can get the right rotations, you can get the right mix of what you're looking for. Because at the end, there's a scramble. You may not get the subspecialty you're looking for. You may want to do an internal medicine rotation, but there may only be a neurology rotation available. And then you're forced to do a neurology rotation. And then, you want your CV to look very comprehensive when you apply for the match. You want to make sure you've done your rotations, you have the right letters of recommendation, you've done the rotations in the geography you want to get the rotations done in. Because also what is very important is, and I've noticed that students who rotate with me in Houston and Texas, they do get a lot of interviews from around the area, right? And I also get a lot of calls from program directors asking me, how was a student on the rotation? So it's very important to try and do your rotations also in a geography where you want to match or where you have family or which is IMG friendly. And over the last maybe 2 or 3 years, Texas has become more and more IMG friendly because a lot of new programs have opened in the area. So that's the reason I would say start early so that you can get the exact kind of rotations you want, including geography, inpatient, outpatient, subspecialty exposure, and core internal medicine.
Yeah, thank you. And I guess last couple of questions before we let you go. So, what are these program directors looking for as they assess the IMG applications or in the interview when it comes to asking about US clinical experience? So what skills and experience they look for, and B, how's your rotation preparing them for exactly the same, preparing them for the match, day in the life, etc., etc. So 2 questions. What are the PDs looking for?
So start off with the PDs are definitely looking for US clinical experience, right? They want to make sure that you have rotated and you have done about at least 4 to 5 months of rotations to start off with. Then they want to really know how you performed on the rotation, right? So they want to make sure that your medical knowledge was good, your interaction with patients was appropriate, you were able to gel well with the rest of the team. So those are very important factors. And that's the good thing. When you rotate with me, you get a chance to rotate with, fellows, medical students from the University of Texas, and you get a chance to work with the residents. So it gives you a chance to rotate with the various members of the team. And it really gives me a chance to see how well you interact with all of the members of the team. And that's something program directors definitely want. They want someone who's a team player. So I think my rotation helps you become a team player and helps me assess how good a team player you will be. So that's important. The other thing that is important is they want to see how you will, especially, being from Texas, the program directors in Texas want to make sure that you are culturally aware of how Texas is. You can gel with patients from the area. What is very important also that I've noticed more and more coming in the last 1 or 2 years is language. A lot of program directors want to know how you interact with the Hispanic community and maybe Latino patients. And there are a lot of programs in Florida, in Texas, Southern California, where there is a substantial Latino population. And so it's very important that I try and make it a point that you also pick up some basic Spanish skills when you're on my rotation. I think Razi has rotated, and I sometimes have it where I have each of you all tell me 3 new Spanish words that are important with regard to your clinical Spanish. So I think those are the things that the program directors look for. And as long as you have a good letter of recommendation, you've rotated in a good university program, because that's the other thing. A lot of students rotate at programs that are not academic. And program directors are not very certain as to what to make of those letters of recommendation. with regard to us, since we are used to, evaluating students, evaluating fellows, evaluating residents, they have more respect, or they take our letters of recommendation more seriously, because we are more into the job of evaluating residents, medical students, things like that.
Absolutely. Well, thank you, Dr. Korea. And by the way, for those of you interested in Dr. Korea's rotation, the links are there. One last question, Dr. Korea, before I let you go, is a lot of students may not get visa, right? Or they have other travel issues, so may have to do it in a tele format. Otherwise, of course, they can do it on site. So there's always a question, are tele-rotations still useful? How do PDs look at it? So for those of us who cannot do on-site, shed a bit of a light on how your tele-rotations work and how students can still use tele-rotations to demonstrate their understanding of the US healthcare system and equivalence of USCE.
So I think obviously an in-person rotation is the best thing to do. But obviously, visas can be hard, and then sometimes students can have financial constraints as well. Students may have family constraints and things like that. So in those cases, a tele-rotation is definitely the way forward. When you'll do a tele-rotation with me, what I try and do is have you kind of navigate through the EMR. So I do Zoom sessions where I show you all the EMR. We navigate patients that we've seen in clinic or in the hospital, and we do a discussion on all the patients that we see that are on the service. So that way you get a chance to basically see patients that are inpatient as well as outpatient. You'll get a chance to work on the EMR because you'll get a chance to navigate the EMR as on Zoom. And I think we more or less cover everything else except for maybe sometimes your interaction with the team. So that kind of is something that you do not get to do on tele. But for the most part, I think the tele rotation, we do try and cover most of the important core aspects of what are expected of you on a rotation. And so we're able to, I'm able to, evaluate you well, give you a strong letter of recommendation based on your tele rotation. And I've seen students do well and actually get good interviews based on a good tele rotation as well.
Yeah. Well, thank you. Thank you very much, Dr. Korea. I appreciate your time, and I know you're driving, so we'll let you go. But thanks for your time.
Absolutely. Look forward to interacting with all of you all more. Thank you. Bye-bye.
Right. So, let's go back to Razia. Razia, I think you were in the middle, and now that Dr. Korea, had come in, so if you can, so a couple of questions we had for you. A, what should students be preparing for as they, get ready for any rotation, right? What in terms of basics, in terms of, knowledge, what is that you advise the students to get used to and get prepared for, whether it's the US system or things like that?
Firstly, I think it is important to work on the visa before you get here. If you have the visas, then it's about accommodation. And then sometimes, most of the times, people end up emailing to get a rotation. I personally did not get much of the time to email and look for the other things because I'm a full-time student. So I reached out to Sarthi because it was a great, they gave me a very good rotation that wasn't expected. And so this really helped me to kind of prepare for my rotation way ahead. Since this was a hematology oncology subspecialty, I got an idea about basic case histories as to like sickle cell disease, all these thalassemias, to get an idea and then walk into the rotation. It's not like going in there and being blank about what this rotation is. And it really helped me because you gave me heads up way ahead. That is like 1 month ahead, where I was able to put everything in place. And this was very nice. I must say this.
All right. Very good. Very good. Any other tip that you have for students who may be starting their USMLE journey or rotations soon? Anything that you want them to know?
I think it is important to plan on the rotation way ahead, soon after step one exam. Personally, I believe you need to get the clinical exposure as early as possible, and this is very crucial because the way we treat patients, the way we look at patients back in home country is way different to how we are expected to do over here. And so I believe that this is something to work on way before you get into any other process in this journey.
Yeah. Thank you. Thank you. All right. Then our next speaker is Jay Mehta. So Jay, he's also a student. He did his rotations as well. So Jay, maybe the same. If you can introduce yourself, tell us where you are in the journey, and your learnings from the USCE. What did you learn, and then tips for the students.
All right. I'm sorry, Pawan, but I'm going to steal your intro because I love it. So, good morning, good afternoon, good evening to everyone from wherever you are right now. I'm Jay Mehta. I'm actually a recent graduate from India, and I'm currently applying for the 2025 match season. I have in total of 9 to 10 rotations, which total in time combined to about 11 and a half, 12 months of USCE. So speaking from experience, I think USCE should be one of your core tactics when entering your USMLE journey, because something that I've found relevant about USCE is how the United States medical system differs from the home country experience that you have been in. So me personally, I started my experiences when I was in my internship back in my home country. So I initially was hesitant going into it because I wasn't sure of what exactly to expect. And I was going into an entirely new playground. So I just started with one clinical elective, and that is when I found my interest to join United States and to further pursue my USMLE journey, because my first experience and my first clinical experience was just so amazing, and I made sure to make the most out of it so that I get the best benefit of the clinical experience that I'm going into. I came across SARTHI this year in 2024, and I did 4 rotations from SARTHI as a part of my clinical electives and externships. Because I graduated a lot, there's a lot of myth around the fact that, once you're a graduate, you can't get enough hands-on experiences because all the options you have is either like a research rotation or observerships. But SARTHI helped me find a few really good hands-on rotations with some of the most amazing faculties that I've been with. And I've been to cities like Chicago, Detroit, New Jersey, and those have been one of the most amazing experiences that I've had right now. So something to something to keep in mind when you start your residency is that, and this is something that actually an attending told me, you don't have to know everything. Like in terms of medical knowledge, you don't have to go in on the first day prepared with all your guides and studied to the teeth. That's not needed. What's needed is that you show the curiosity to learn. You are there to absorb all the knowledge. You are there for a month, you're there for 2 months. For me, even a month was not sufficient enough because I just wanted to absorb whatever I can. So be a good student. That is the first thing you go into as a clinical elective, irrespective of whether you have completed a residency, you're a medical student, you have graduated, doesn't matter. Be a good student first. And the second thing is just be humble. And trust me, like attendings love that. If you ask as many questions, be humble, be on time. And this is something Pawan told us way before, even when I started my clinical electives, is be well groomed, shower really well, because that is also a very important part of your elective. So all in all, just the basic etiquettes of a good student and be present in the journey will actually help you thrive in your clinical electives and actually impress the attending so that they give you a good personalized letter of recommendation at the end.
Very good. And I guess since you're applying for the match this season, so what skills and experiences did you highlight in your CV? And, so how do you intend to use the USCE experience with the programs at a high level?
Right. So first of all, highlighting USCE into your CV is very important because this shows that you actually are familiar with the system. You have been a part of the system for how many duration you were there with, and this shows that you have interacted with patients. So all in all, it basically means that you would be easier during your PGY1. It will be easier for you to transition. So that is the most important point you have to highlight in your CV as well, that you have enough interactions with your program director or the attending. You have enough interactions with the patient so that it's easier for you to transition and into a PGY1 position. Because if you waste your PGY1 just learning about the basics of electives or just like patient care, you wasted an entire year of learning. So that is, I think, what I would do to highlight my clinical experience is that the first thing I would write is all the basics of what I learned. So, I interacted with patients. I saw these many patients a day. I had access to this EMR. So basically highlighting, I interacted with the EMR as well. So I might not need to start from the basics to learn the EMR. And one thing that I do, and I recommend everyone to do, is write one key experience. Doesn't have to be a patient experience, doesn't have to be anything. It could literally be as clear as, I am I'm an introvert, but working with the attending, making new friends. It brought out my speaking. I brought out my speaking skills. I came out to be vocationally active. So just bring one key experience into the CV, and that will highlight that specific clinical experience, and it will basically bring out the meaning from that experience. So for the program directors who read your CV, it basically shows that, oh, you learned something. It wasn't just a tick on your CV that USCE done. No, you actually learned from your clinical lectures, and that is what we are actually there for, our rotations.
Yeah. Last question, I guess. Many students have this question: how to differentiate between observership and hands-on? So, and what is more important?
So hands-on could be two. So one is before graduate, which basically translates to clinical electives or clinical rotations. And the other types of hands-on would be after you graduate, which technically are termed as externships. Observerships are usually for graduates who after graduation wish to continue in a university setting. So generally universities don't hire graduates to participate in hands-on learning. They prefer students, they prefer undergrads for that same. So that is why observerships, definitely you get to round with the attending, you get to go into a clinical setting, which is a university hospital. So here it's basically a team of residents, fellows, attendings, nurses, APRNs, and you basically see the team dynamics of the hospitals. But one of the cons of that is that you don't get to interact with patients. You have you can't physically examine the patients. All you can do is access the EMR and present the case. That's all you can do. As in terms of externships, you basically rotate with a doctor either at the clinic or you could go to the hospital they're affiliated with. And the benefit of externships is that you get the hands-on experience. You get to talk to the patients. You get to examine the patients. You get to present the cases. You get to write notes. So it's basically, I would say, training PGY1. That's how I claimed externships to be. And clinical electives are entirely like undergrads. It's basically like American medical students and you at the same level. And you go in as a medical student, you have access to whatever cards you have. So you have access to whatever faculties they give you the access to. You can access the MR, you can access patients, you can present histories, but all of this is only for undergraduates, not for graduates. So I think that is the major difference between observerships and externships.
Okay, and I do see a lot of questions that I will answer, so don't worry about it. We just are very, very aware of the time constraints that our speakers have. So, their experiences, how they share it is more important. So I will get to the questions. But thank you, Jay. Appreciate your time. And of course, good luck for the match.
Thank you.
We hope to hear good news from you very, very soon.
Thank you so much.
Thank you. Thank you. All right. Our next speaker is Dr. Nidhi Beniwal. So, Nidhi, let me give you access to the video so that you can share it. And, thank you. We can see you. Congratulations and welcome here. So, introduce yourself. Tell us where you are in the USMLE journey, and the importance of USCE, importance of starting early, tips for the students, and what you have learned as part of your USCE, the various USCEs you may have done.
Thank you, Pavan sir. Hello, everyone. It's great to be here today and guide all of you. My name is Nidhi Beniwal, and I'm also an international medical graduate who has done her MBBS from India. Currently, I am ECFMG certified, and I'm applying for the Match 2025, so just applied in September. And my goal is to get into a pediatric residency. So that's just introduction about me. I'm currently living in California and doing a rotation right now while preparing for my interviews. So I started my medical journey in India, and over the years, I had the opportunity to explore different aspects of medicine, both India and the US. So that's basically what we're discussing today, USCE. And I did most of them. I just didn't do the part when you come during your internship, like Jay said, which is probably the best one. Couldn't do that because of COVID and during my time. So I did, the first thing I did was, I'm a US IMG, so I'm a citizen. So I did, the first thing I did was come to a hospital and volunteer to one of the children's hospital, a very good one. And that was inpatient, so I got to interact with hem-onc patients on the unit and got to observe how the unit works, how the floors work over here, which is called wards back in India. So terminology, first of all, you learn a lot of terminology while you're USC. You learn how to, the other thing that was very different from the India and probably your countries and here is when looking at outpatient clinics, we get to see a lot of people in a line, but here we go into rooms. So etiquette's how you see patients in rooms. So this is basically hands-on, but what I gained from USMLE Sarthi was a tele-rotation, actually 2 tele-rotations. And being a US citizen, you might be, why did you do a tele-rotation? But while on my hands-on, I saw a lot of tele-patient meetings. So I was like, this is becoming a very important aspect in US medicine. So I want to do a tele-rotation as well. And believe it or not, it was a very, very good experience. Of course, tele-rotation does give you the same, if you're not able to get your visa, I promise you it gives you the same bedside experience through Zoom rotations. It gave you a very good EMR navigation. I mean, I had already done EMR here. I had direct contact. So when I was observing the tele-rotation EMR, I was like, students who might have not even started EMR will get the same experience from Tele-Rotation. And the good thing about Tele-Rotation was when you're on hands-on in the clinic, you see the patient come back. But in Tele-Rotation, you're looking from a very you see everything that's going on, and you could discuss everything with the preceptor. After seeing the patient, or even after clinic has ended, you can sit with the preceptor on Zoom and discuss everything you're observing, everything, every case, any. So I just remember one case. I was with Dr. Arain during one of my Tele-Rotations in Kentucky, and I even if there was something to examine and she found a finding, so she would bring up the laptop and with the permission of the patient and show me everything. So there was a case of blepharitis. She showed me the eyes and everything. After that, we also discussed everything, the new recent treatments from US uses in every residency and all over the world. We use UpToDate. So she would give me UpToDate access, all the articles about blepharitis. The next day we would discuss further that what we gave yesterday as a treatment, what's the newer guidelines. So US clinical rotations is not just about learning the etiquettes, the EMRs. It also teaches us how the US residency would be like, how they also taught us stuff like you would be presenting every day, you would be what case presentations they would be expecting during residency. They kind of give you a glimpse of a resident how your day would be in residency. So not just getting acquainted to the US clinical system, but also getting a day-to-day a glimpse of what your day-to-day life would be in residency, so it doesn't look new. They also told us everything about M&M cases and our health and well-being, and so it's not just going in and looking at patients, but these clinical rotations, the preceptors will give you a very good insight of how residency will be as well. So this is what I have for you, but do you have
No,
any
thank you.
questions
This
for
was
me?
very useful, and I think
Yeah.
a lot of good information for the students. Now, one last question. As they start either a tele-rotation or an on-site rotation, what should they be prepared for, in terms of their clinical knowledge, or what do you expect them to know on day one?
So
Before this?
on day one, Dr. Pavan sir, I was hello.
I'm sorry, go ahead.
So day one, I did some rotations before step 2 and then some after step 2. I would say clinical knowledge is a good aspect, but if you're doing before step 2, you will gain the clinical knowledge which will help with you with step 2. And if you're doing it after step 2, you will realize that how step 2 is actually what you see in a day-to-day basis. But one of my preceptors said, we're in this medical field, we're always learning and we're always teaching. So if we're coming in after step 1, we have a good amount of background. So we're still learning, and we have a good amount of knowledge to be teaching. So we're still doing our presentations, and the medical student, you will always have medical students there also, and you could always teach them as well. So in any state, don't think that, oh, I need to give step 2 and then go for rotations. No, you have a good amount of knowledge and you're able to teach that. And after step 2, you are not amazingly great. You are still learning. So I would say, as everybody said, Jay and then Dr. Amit, start early as possible, because the system is very different and you might like it, you might not like it, you might the language, the system, how you see patients, how you process documents, how you write everything down. You want to start early. Never think that you still need to learn more before starting a rotation. So
Yeah.
that's what I
Well,
would say.
thank you very much, Nidhi. Appreciate it, and good luck. Hopefully the match
Thank you, sir.
goes well, and give us the good news as soon as you have
Yes,
it.
sir. Thank you, sir.
Thank you. All right, let's move on. I think our next speaker is Dr. Cedric Coleman, and Let's see if he has joined. So Dr. Coleman, I think you're there.
I'm here.
You just a different link. How are you, Dr. Coleman?
I'm okay. All right. Thank you for being patient. I had a phone call from University of Chicago before I came on. So I told Ms. Banks to let you know I was answering that call and then just fit me in whenever you can. How are you doing? How are you guys doing?
Good. So we are all eagerly awaiting Dr. Coleman. So Dr. Coleman, of course, has been helping our students for several years, along with Ms. Toya Banks. Is a professor at Rush University, does both online and on-site rotations. So Dr. Coleman, just wanted to pick your brains. A lot of students want to know, why should I do a tele-rotation? That's the first thing. And second, what skills and experience should I look to gain that will help me in the residency match?
Okay. We talk a lot about doing the clinical rotations, and that is very important. But in talking to the program directors, they were a little concerned. This goes back to about 8 years ago. They would tell me everybody's doing these rotations. They tell me they have this hand-on experience, but then when they get to us, they don't know anything. They said, so what's the problem? At that time, I had stopped seeing a lot of patients in the office, a lot of students in the office, just kind of seeing patients myself, doing a little bit of online stuff. So we started bringing students back into the office, and sure enough, we would have had students that rotated at some prestigious institutions, but then going through the basic information I want them to know, no connection at all. So there was a difference in what they were walking through in the rotations and then the deductive thinking that the program directors wanted them to have. So we started focusing our program around that, the deductive thinking. When we talk about diabetes, we talk about hypertension, we talk about these things, we go through the data, we go through the information, we go through what they need to know in these chronic disease centers. So now they can have a good basis of taking care of these patients. It wasn't just a walkthrough in diabetes. They actually knew what needed to happen with that patient from start to finish, whether they were simple or they were complicated. The other thing, of course, we have a very good relationship with all the program directors. I think we have students in every program in the country now. And last year, we had 210 students from our program that matched in programs and throughout most disciplines, mostly internal medicine, but throughout most disciplines. And the year before that, we had 280 students, and 90% of our students match from our tele-rotation, believe it or not. Some would have done a little bit of rotations in the office, but and the tele-rotation, but the great majority were just tele-rotations. Because I'm going to tell you, after everything everybody tells you what to look at and everything, the phone calls that are made, everything that's done after you send that application in is unbelievable. There's so many things that happen that you don't know about. Conversations back and forth with me, and all of our people get at least one phone call to a program director along with our letter of recommendation. So phone calls that are made from me, from other people. And the big thing is that we all know each other, okay? So an academic rotation with somebody that I know, that I trust, and they're telling me that you're a good student goes a long ways compared to just having a letter of recommendation from somewhere else. So who you do your rotation with is very important. And if people have an academic background, that really helps. But beyond that, one, getting in to get a rotation in would be great. Two, if we can get the tele-rotation with a good program, and we are the #1 tele-rotation program in the country, with a good program, also gets you in. Like I said, of our 210 people that matched last year, if 30 of those people came to my office, I would be surprised. So it's definitely not a disadvantage to doing the tele-rotation. The program directors are concerned about the deductive thinking. People did the rotations, they did the hands-on, but then they couldn't put the information together. We work closely with the people that write the board's questions. So a lot of our stuff that we review, you will see again on the board exams, whether it's step 2, step 3, or people that did internal medicine, family medicine, it'll be on those board exams also. So we try to stress the academic part and what you need to know, but then the clinical part and working with the patients, the doctor-patient relationship, because we do understand in most cases that our doctor-patient relationship in the United States is different than the doctor-patient relationship in other countries. And we try to really stress that with our patients. because they're going to work with other doctors, not just with me. When they go to Rush and go to different medical centers, they're going to work with other doctors from other communities and other cultures. So I try to prepare them for that, but then also try to prepare us and you with, our patients and other patients from other cultures also. So in trying to put everything together with the clinical rotation within the office, and we do really stress outpatient medicine because in the United States, the reason our system is so expensive because most of our patients are in the hospital. And at $10,000 a day, average admission, 4.5 days, $40,000, we should not be that expensive in the United States. If we were better at taking care of diabetes, hypertension, coronary artery disease, and heart failure as an outpatient, we would have the least expensive system in the world and still have all the medical knowledge that we have. So it's a combination of putting that together to work together with our system, with the different hospitals, with the insurance companies to make sure that we need them to do what we need them to do for us, because it's Medicare that funds the residency programs. I don't think a lot of people know that. And I would much rather have Medicare helping to fund residency programs than to pay for dialysis for people that we couldn't manage their diabetes and hypertension. So in putting the whole scope of medicine together and see how everything interacts, I think it's worked out well. And then having the relationship we've had, with our program directors has been unbelievable. Most of our people that do match do well. Most of our people that do match are intern of the year, and a lot of them later become chief resident. And that's the goal, if that's what they want to do. We want to make sure that they're well prepared so that when we have a problem, when the program directors have a problem, they have a tight, and they need to call someone, they call us and say, hey, we didn't match in our program. Who do you have available? Hopefully, we don't have anyone available because everybody would have matched. But we've had cases where people didn't match, and we just in time, we were able to talk to the program director, got them right in. Or people would have been applying now, finishing their step 3s and everything, and someone had to drop out of a program. Program directors would call us and say, I got a person available for you. They never even had to go through the match. So that relationship with the program directors, the fact that we do everything, and the program directors review our curriculum. We do everything according there. We adjust everything in our curriculum to make sure we have in there what they need for our people to be successful. So it's going to be successful from an outpatient basis. It's going to be successful from an inpatient basis for those that are doing inpatient rotations. It's very difficult to do an inpatient rotation in Chicago. I mean, we have Rush, University of Illinois, Cook County, all within a 3-block radius of each other. But the Rush students cannot go to U of I. The U of I students cannot come to Rush. And county is kind of selective on who they let in, all since this post-COVID stuff. So one, a lot of focus has been more on outpatient medicine on what it should be anyway. And two, it's just been difficult to get the in-hospital rotations. But again, with our relationship with the program directors, we're able to work things out. And then we've done a program where we've had people that finished. We had them stay on with us if they're in Chicago. They can continue to come, they continue to work. They work with us with the other students. And we add that on to their letter of recommendation as a sub-internship. So we have a lot of different ways that we work with them, and everything that we talk about in presentations that we're talking about the core information they need to know for medicine. Then we talk about what they need to know for boards, because I mean, whether we like it or not, we have to take the board exams, but we need to know for boards. And I'm finding out from a lot of people that about 80% of what they had on their last board exams, especially step 3, we're covered in our program. So that relationship with the people that write the board's question, that relationship with the program directors, and then our clinical relationships with our different hospitals, because we have affiliations with Rush, of course, but also University of Illinois, Cook County, University of Chicago, the advocate system. We have a well-rounded relationship, and I think putting that whole experience together really helps. And one, first of all, for a patient a good academic medicine background, and then also as a leeway for them to match in the programs. We started over last year. Every year, we expected a 10% increase in our residents to match. 2 years ago, we got to 280. So then another 10% is going to put us over 300. We were like, okay, I think we're going to have to start over. We started over. So last year, we said, okay, we're going to start at 180 and then work from there. And then, do 10% a year again if we could do that. We ended up having 220 people that matched last year. And again, most of them came from the Tele-Rotation.
Well, thank you. Thank you very much, Dr. Coleman. Much appreciate your time. And as you rightly said, it really matters the deductive skills that you gain at the program. Tele-rotations are equally as important as on-site. And the most important thing, which I think you mentioned, was it matters where you do the rotations and what the relationship preceptor has with the program director, because they can call for you and assist you with the match. And I can assess that a lot of our students who've gone to Dr. Coleman have been very successful in the match, because Dr. Coleman and Ms. Toya Bank, they make it a point to help you in your entire match journey. So thank you, Dr. Coleman. I appreciate your time. And for those of you who are looking for rotations with Dr. Coleman, I think Sneha from our team, she'll post the links. Ms. Toya Banks also has other rotations as well. So let us know if you want any help with Dr. Coleman, and he's always there to help our students. So thank you, Dr. Coleman. Appreciate your time, and thanks again.
Thank you. And Pawan, anything I can do for you guys, let me know.
Thank you. Will do, Dr. Coleman.
Okay.
Thank you. Bye. Let's move on. Our next speaker is another student, Edward, who did rotations. So let me give him the access to the video. So Edward, are you there?
Hi.
Hi, Edward. How are you? I think there is some audio issue or connection issue that you have. We cannot.
Thank you for this.
Oh, now we can.
I feel good, happy to be with you guys.
So Edward, welcome.
Yes,
and why don't you?
Well, but you can hear.
I think there is a problem with the audio. Can you speak up so that?
Okay, I international medical graduate.
Yeah, no, there's some issue with your audio, Edward.
Maybe can I reconnect?
Yeah, if you have issues with the videos, maybe stop the video.
Can you hear
maybe
me?
Just the
now?
audio.
I need to change maybe my position of.
Yeah, maybe there is some issue, and it's a
Okay,
2-day
can you
webinar. So
hear
if you cannot
me?
fix it today, maybe tomorrow is also fine. I think there is some issue with
Okay, let me reconnect in 10 minutes, please.
Yeah,
minutes.
that's fine.
Now it's better?
Yes, this is better. At least we can hear you. So Edward,
Okay.
why don't you introduce?
Correct. Yeah, I very old graduate. I graduated in 2006. I'm from Peru. I am a gastroenterologist for 15 years. I decided to pursue my dreams for the medical school to be a doctor in the US. I tried to match in 2013, but I couldn't do it. I had some interviews, but I couldn't get a position in the match. So I decided to get a better opportunity by USMLE. So I took some rotations. Sarti really helped me to get hands-on rotation in New York. That was very important for strengthening my profile. I got a good LOR. I got a good communication skills during the rotations. Obviously, this is helping me for this season. I am applying to internal medicine this season, and thanks to this rotation, I really got some opportunity for this season to get into the maze. So I really grateful for USMLE Sartre to give me the opportunity to be in the hands-on rotation in New York. I'm really happy to be with you in this big community. Thank you.
So, Edward, what are your tips for the students? What skills they should try to learn as part of the USCE?
Okay, first of all, you need to start as soon as possible because time is very important. You need to start right now, next month. Please don't wait until every March. No, you need to do it right now. As much experience you can learn, it's better for you. Second, you need to be a good person. Not only a student very smart, but you humble, good person, and also to develop good communication skills because this is very important in the interview system. You need to be very adaptable to talk with any kind of the applicants, and so be very passionate about your medicine. So be humble and develop good communication skills is very important in the survivorship rotations. Okay. Another important tip, obviously, you need to be on time, be with the attending until the end, try to ask questions about difficult case or some cases, and try to interact with the other staff, only nursing staff, social worker, because it's part of the job in the survivorship. But in my opinion, for me, Sakti really helped me to get good rotation, hands-on rotation, to get involved in the electronic record, to get good LOR, to improve my communication skills. And also, you need to prepare some examples, experience in the interview season to show that you are very interested in the US system because it's completely different. I came from Peru. It's completely different, the system from Peru, from the US. I mean, every international American graduate can compare his system with the US completely. So in rotation is very valuable things, and you need to start as soon as possible and start to have many options, Tele-Rotations, observation, hands-on rotation, program director. It's amazing the program that you really have. So I'm very happy with you.
Well, thank you. Thank you very much, Edward. Appreciate your time and your tips for other IMGs. And of course, good luck for the match. We hope you will give us good news very soon.
Thank you, guys, and best luck for this season, all you students. I really appreciate your help.
Thank you. Our next speaker is Mohammed Anas. Mohammed, let me give you access. Okay.
Hi
Yes,
guys.
Mohammed, how are
Hi.
you?
All good. How about you?
Good. So thank you for your time. So why don't you introduce yourself and then talk a bit about your experience in rotations, your learnings, and tips for other applicants who may be planning to do rotations in the coming months.
For sure. So hi guys, I'm Anas Siddiqui. I'm from Karachi, Pakistan, and I study in Dow International Medical College. So I'm a final year medical student right now, and I did my rotations with USMLE Sarthi. So I did one rotation in Chicago with Dr. Coleman. So that's a brief introduction. So when it comes to tips, I would like to say make sure that you don't delay your rotations, and you make sure that you do them from trusted sources. For example, Sarthi has a nice reputation, and I knew it from friends before, so that's why I did with Sarthi. And to make sure that the rotation is with a well-renowned doctor. So we had it with Dr. Coleman, who has years and years of experience. So I think that really counted. And more so, while you're in the rotation, I would like you to make sure that you're engaged completely when it comes to patients. You can learn as much as you can with the doctor in pertinence to medicine, and also apart from it. I feel like Dr. Coleman also imparted a lot of life lessons to us. So I think that was also a very nice thing about the rotation.
Yeah. And why is it important to start early? I think that's a question a lot of them have, why shouldn't I wait for later on to start?
Yes, I think in my case, I'm a final year medical student right now, as we know. So I did definitely start early because when I came for rotations, there were a lot of people who were who had graduated way before me, you know. So the reason why we should start early is because the journey itself is very long and you never know when you're going to get matched. So maybe you get matched the first year, maybe the second year. So you want to get started as early as possible. So that time comes early enough. More so, I feel like if you start early and you do your rotations early and get it done, I think it's also a good impression overall because when you go for the interviews in the future and all that, they get to know that the person is punctual and they're serious about it and they're not doing stuff last minute. So I think it's overall a good impression and a good portrayal of how serious the person is.
Yeah. One last question before I let you go. In terms of adaptability, challenges, getting used to the US system, and how different was it from your home country system? What were some of the observations you had? What were some of the challenges?
To be honest, I always say this to even friends when I came back. I think it's completely different, and it's actually way better. I feel like the system really cares for the patient. It's put into place where a patient, can be heard. And for example, with Dr. Coleman, he used to give the patient the time that they deserved. And secondly, everything is online. So I come from Pakistan, everything's on paper over there. So they just write prescriptions, quite unorganized. They're great doctors, don't get me wrong, but the system is kind of outdated. So when I came to the US and I saw that the EMR is pretty amazing, everything is up to date, nothing is off record, all the patients have their rights. It's very nice. So I think that was different. More so, I also say that in that 1 month of rotations with Dr. Coleman, I learned more than I did in my 3 years of university rotations. So that's one thing because Dr. Coleman, I can give you an example of that rotation because that's my direct experience. Amongst other rotations, his rotation actually. So this is what he taught us in a nutshell. So firstly, he would make sure that we know all the basic facts that are important. Every student must know them. It could be a deal breaker if you don't know them. So pertaining to medicine, he emphasized a lot on data. So that was very important. Then also, while I was with him, I saw him do a lot of calls, for like for example, to pharmacies and to all those places. So that really gave me an idea about how he can deal with those things, as a doctor, for the patient. And then the third thing, he really taught us about how to a lot of life lessons. He told that you have to be honest. That's the best policy over here, and all that kind of stuff. So, uh, so that's what I learned. The system is pretty amazing. Only one thing about the system. I think too much perfection in the system sometimes delays the things. For example, some approvals and all that. So that's the only con. Everything else is pretty nice.
Well, thank you for sharing your experiences, Anas, and good luck
Thank you.
for rest of your medical school education. And we look forward to helping you in your journey when you're ready.
For sure. Thank you, Mr. Kira. It was amazing
Thank you. Appreciate your
to be
time.
on it. Thank you.
So, like I was saying, I think Sneha is not there, but for those of you who do want to see where the rotations are, let me just quickly share my screen so that you can see this. So, obviously, you can go to the direct website right here, residencymatch.usmlesarthi.com. You can look at housing, you can look at clinical rotations right here, read how to book it, and then you can pretty much sort it. Hopefully my screen is visible. So you can sort it any which way by specialty, type of rotation, state, etc. So that is the one way to do it. You can see all the 260 rotations. And there are other ways, of course, if you go to our main website, which is usmlesarthi.com, right here, and if you click on rotations, then also you can go down. Let me see. Okay. On the rotations page, and I hope I can get there. So on the rotations page itself, you will see a list of Excel sheet, which I think Sneha has just posted. So that Google sheet or Excel sheet, you should be able to, just sort out and filter. Okay, so here it is. It's taking a bit long. So right here, usmlesarthi.com/clinical rotations. So you can check out our rotations. Click on this page, list of Sarthi rotations, and here you will see all our rotations, the specialty, state, type, hands-on, etc. And you can sort it. If there are discounts, you can look at the discounts as well. The links so here on the rotation location code will take you to the full description. So, this is just a summary sheet that gives you all rotations. You should be able to sort it and look for the specialty, state, etc. that you need. So, in one sheet you can do that. So I just wanted to make it available. So Muhammad Anas, did you have any closing comments, or I wasn't sure if you had anything else to do?
No, it was all good. I think I
Okay.
shared what I
Thank you.
Right.
Thank you very much.
Thank you.
Our next speaker is Mohammad Amir. Let me give you access, Mohammad Amir. And if you're still there.
Yes, I'm here.
Yes, thank you. Now we can see you. So welcome, and why don't you introduce yourself and tell us a bit about your USCE, some of the learnings, and of course, tips for students who may be thinking about USCE in the coming season.
Right. So hello everyone. My name is Mohammad Amir. I'm a final year medical student at Dow International Medical College, Karachi, Pakistan. And I recently did 3 electives in the months of July, August, and September. And I did August month with Dr. Coleman through USMLE Sarthi. And this is a brief introduction. Regarding tips, I would say it's really important to start your process as soon as possible. This is what I've learned so far, that if you start your step 1 and electives through 3rd year and 4th year of your medical school, you eventually get ahead of the process, and this way you can get early through the cycle. As one of my colleagues also mentioned, that you never know when you match, and if you start your process early, you can get early through the process, because we see a lot of students who start the process late, eventually after graduation, and then their year of graduation is 2, 3, or 4. So you want to minimize that possibilities.
Yeah. In terms of, like I was asking your colleague as well, in terms of transitioning to the US system or learning, the differences between maybe the system in Pakistan and US, what was your experience? How easy was it? How difficult was it? Talk to us a bit about that transition.
Right. So the thing is, managing patients in Pakistan is completely different from US, because in Pakistan it's all it's like the old-fashioned way of going through things. And if you step into the US program, you see there's a lot more into medicine. There's a lot more into the health system that you can go about it rather than just using the same old methods. So it's same way when we go about going for insurance purposes or going through EMR, and everything is just organized properly. If the patient needs access to anything, it's always there. If it's the doctor needs anything, if the patient is reference to a new doctor, so the new doctor also has all the information. So everything is organized, and that's, I think, the main difference between the medical system back in Pakistan and here.
I see. All right. Very good. Any tips or anything that was pleasantly surprising for you as you were doing your USCE, or maybe some other learnings, what should students be prepared for, whether it is, just the cultural shock or the differences or anything that you think that they should know beforehand?
Right. So I have a few things which I would like to say. First is that, you get to see a lot of new patients, because what we see in many of us students here.
Oh, I think we lost him. Okay. I think, Mohammed, we lost you there for a
For
minute.
step one, we see, okay, we see a lot of diseases, which is common in.
All right. I think, I'm sorry, maybe he was having some technical problems, but apologize. We will try to get him back. But don't worry. We have our next speaker, Anvit, also online. So if Mohammed has issues, we'll get him again. But Anvit, let me go to you. Welcome, and why don't you introduce yourself, and then your USC journey, tips for students. What did you personally learn, and how is this being helpful to you overall?
So first of all, should I continue because
Okay, Mohammed, you're right.
Yeah.
Mohammed is back. Sorry, Mohammed, why don't you continue your thoughts? I think you had a connection issue, but are you back?
Yes, I'm back.
So yes, you were talking about step one or some of the tips that
So
you can
what
start
we do is,
again with that.
so basically in step one, we learn a lot of diseases which is common in America and Northern Americas, and we see a lot of patients from Pakistan. Like, I'm coming from Pakistan, we don't see a lot of varieties of patients. But when we head into America, we see a lot of patients from different diversity and
He really is in a bad connection area, I guess. So why don't I answer questions that are coming up at this point? If he's able to join back, we'll take him. Otherwise, we'll go to Anvit Nanavati. So is failing step one a major red flag? This is a question, and I'll go through the questions. So it is a major red flag. Let me be very, very frank about it. However, there are students who have matched after failing step one. It depends on a lot of other factors, CK, step three, clinical rotations, USCE. Maybe we need to change the specialty. IM would be harder, so we'll have to talk about it. But you can obviously set up time for a profile review. But yes, it is a red flag for sure. Okay. Then what is other questions? Okay, he is back. Let me make him a co-host again, Mohammed.
it's
Okay, Mohammed.
I'm getting calls again and again. That's the reason.
Oh, okay. Yeah, sorry. So you may be on calls or something. Okay. So why don't we quickly take that question that you were trying to answer?
Right. So basically, what I was trying to say is we get to meet new patients, right? So we see patients all sort of nationalities. Secondly, I would like to say is that when we use EMR system, so we basically are prepared for PGY1. So what we do in electives and observership is basically what we'll be doing in PGY1 as well. So writing patient history, how to properly organize everything, how to get through with all the EMR system is basically what you need to be prepared for. Secondly is your presentation and communication skills. So try whenever you go for electives, right? So go ahead, talk with the doctor, find out any new diseases, and then take like case reports and start research and stuff with the doctors. Take help with the doctor. If you find any new research case, if you met a patient with a new disease, which not many researchers are there out there, so you get a new topic and you can get engaged with such researches. And presentation, start like if you find a new case and then just have to present with the doctor and the students out there, it improves your communication skill as well. And I would say be organized, help follow your deadlines, and if you have planned for certain exams at certain time, follow that and don't delay. Keep that your number one priority. Thank you.
Yeah. Well, thank you very much, Mohammed, and I appreciate you taking time when you are probably on a 24, 36-hour call. So thank you, and thank you again, and good luck in the rest of your education and the USMLE journey.
Thank you. Good luck to all.
Yep. All right. Now we are back. Anvit, sorry. As you can see, we had some issues, but yes, back to you. Why don't you introduce yourself and talk to us a bit about your USCE experience and tips for the students?
So I'm an international medical graduate from the Philippines. I have completed around 7 months of clinical experience in neurology, which is a specialty that I'm applying this year. At the same time, I have 1 year of clinical experience in the research field. I have published papers both in the US setting as well as back in my home country in India, mainly in the field of neurology. At the same time, I have worked as a resident medical officer back home for around a year, as well as worked for a month in neurosurgery as well, 1 year being in neurology.
Yeah.
So
So,
that's brief.
yeah, let's talk about you have extensive experience. So, your perspective could be very different about your transition to the US system. What did you learn? How was it different, or maybe not? So, what were your thoughts when you did your USC?
So for the first time I came to the US for my clinical experience, obviously there are a few nuances which are different from an IMG's typical home country and the US. So the first thing which was mainly new to us was the EMR system. We obviously see a lot of patients back home and we do detailed paperwork as well. But in the US setting, this is more digital. So you need to note everything down, and everything has a very it's kind of, you can send files, whether it's scans, whether it's maybe case reports or the patient's history, you can send it directly through the EMR through to various clinicians, whether they are in the same state as the attending or in different states. So it's definitely more convenient to share those informations between the multiple providers of the patients. At the same time, the thing about the US system is that everyone is really, there's a good camaraderie here. Everyone is open to giving opportunities to everyone. So that's one tip I would like to tell everyone here, is that don't hesitate to ask for opportunities, because quite a few times, whether it was research experience or being able to perform certain procedures or ancillary tests, even though they might not have been typically part of the curriculum of the rotation, but since I would perform well, the attendings would go out of the way and request for permission from the university for me to be able to perform those procedures, obviously alongside the supervision of the attending. And in my case, most of my rotations have been through university programs. I also worked with some mentors who, when I showed that I was performing well, they recommended me to their colleagues, who were then able to give me opportunities which normally would not have existed for IMGs. So, as I said, just be open to learning, and main thing is, don't just feel that just because this is your first rotation, you are allowed to not know everything. Yes, it is correct. You are not expected to know everything, but at least if you're applying to a certain specialty, you should at least know the bread and butter of cases of that specialty. Because even though you may be a medical student or maybe a medical graduate performing or going to these rotations, they are not going to teach you how to perform basic bedside skills or physical examinations or history taking. That is something they expect you to have a fairly good grip on. And if you have that, you then get to pay more time and more attention to certain other aspects of the rotation,
Yeah.
which would be my tips.
And how was your personal experience? You are very, very qualified. You have extensive experience. Was there enough learning for you? How was that experience?
So, as I say that no matter how much you learn in the field of medicine, you're always going to learn more. So whether I've worked in multiple states in the US, and one thing that I've found is that even between the states, there are going to be many cultural differences. There are going to be many differences in the way cases are approached in a hospital setting. So especially being able to see rare cases, that is something that you may come across cases which, even though I've seen like some of my mentors, even though they've practiced for 10, 15 years, there have been some cases which they've just seen a handful of. So just because you come with a few years of experience doesn't mean that you've learned everything. There's always more room to learn. And that was what I experienced as well. Whether I went to my rotations at university programs or hospitals, there's always something new to learn. Whether it was a way a procedure was handled, maybe a new invention or a new way of performing that procedure, or whether in some of my rotations, I would also present cases alongside residents in grand rounds. So that also gave me a good idea of how to present cases and how to deal with the intern year of residency. So these were definitely things that I was able to learn more about being in the US system hands-on.
Yeah. Well, thank you very much, Anvit. I appreciate your time and patience, and you really gave us some very good tips. Good luck in your journey. Give us the good news, and thank you very much.
And thank you, and thank you for the opportunity to share my insights with future aspirants. Thank you.
Thank you. Thank you. Again, to our attendees, we will have day 2 tomorrow, same time. But before, as I promised, let me go over some of the questions that you have asked, so that we are clear on certain things. So there is one question around how much US clinical experience one should do. I think, like a lot of speakers already said, minimum 3 months is an absolute requirement. Obviously could be a mix of tele and hands-on. Hands-on is preferred, but of course, tele-rotations are also valuable. If you cannot travel, you have financial issues. We have students who have matched with tele-rotations also, even in the last season. So then there is a question. I'm IMG from Georgia, currently in 4th year. Is USC alone enough, or are there any requirements I should be aware of? So we will have a lot of webinars, but basically USC is one of the most critical components of the match. Then it is obviously your scores as well in CK, probably step 3 if you can take it, and research. So these things are very important as you plan your USMLE journey. What if we do USCE before step 1? You can. There is no rule that you cannot do it before step 1. But there is. It depends on where you are in your MBBS journey. We do have a complete timeline that we can help you with. There's no rule, but sometimes a lot of students find step 1 first and then electives is a good idea. So, but you can do it before that. MD microbiology in India, and they want to do USMLE. Will it be difficult due to non-clinical residency background? So home country residency is always a good idea. Microbiology, of course, is non-clinical, but it's still useful. I think it'll all boil down to what your scores are and the relevant USCE that you do. So for example, if you're interested in internal medicine, how much of IM experience can you get? So that's that. If there are other questions, I'm happy to take it today. Otherwise, of course, tomorrow we'll go over the same. We'll have new speakers, new panelists. I think we have our physicians in pathology and some of the other panelists as well. When is the right time to start USCE after completing step 1 in third year medical school MBBS? So a lot of students do USCE in their intern year. I think that would be a good time. And of course, like I said, we have a complete timeline, which is freely available on our website, and we'll probably send it to you. As a first year MBBS student, when can I do my USC? First year is too early. Don't worry about it. I think if you are interested in USMLE journey, of course, get your basics straightened out. Probably starting with research is a good idea, and maybe a tele-rotation, but I think first year is too early. So maybe end of year 2 would be a good idea. I'm a postdoc pathology, home country residency. Will that experience help me match in US? Yes, absolutely. Home country residency in pathology, matching in pathology is very much aligned with what they're looking for. May I get all the links in email? Shiva is asking, yes. We will follow up with an email that'll give you the links to the rotations and some of the blogs. How competitive is pathology for a non-US IMG? All specialties are competitive. Pathology, people were thinking till about 3 years ago, not that competitive, but times have changed. It is competitive. They are looking for you to get pathology specific, US experience, lab experience. And of course, if you have a home country residency, it helps. It is not easy anymore. That much I can tell you. Emergency medicine applicant, is it beneficial to join rotations in other specialty? I think one rotation here and there, like in internal medicine, pulmonary critical care, etc., would be okay. But of course, the more you focus on emergency medicine, and they obviously have a separate SLOE, structured letter of evaluation, all will help you. Is VSLO registration needed for getting electives? It's good if your college has it. I think very limited number of colleges have it, but no, it is not the requirement. Obviously, majority of our students don't come from VSLO colleges, so it's okay. I have 3 rotations. Will that be enough? It depends on your profile, year of graduation, gaps, etc. And how recent those rotations were. I'm aiming for internal medicine. Will cardiology rotation be beneficial? And the answer is yes. Cardiology is an internal medicine subspecialty. It will help you. So with that, let me just close here. Join us tomorrow. I'll take up more questions. You will get to hear from more speakers. Same length, same time, 11 a.m. Eastern tomorrow. And we'll be there to answer all your questions. Okay. So thank you all. Have a good night, good rest of the weekend.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.